And we are getting set up for you because we are able to take your live calls on this show. All you have to do is call in at the phone number in the description. I still haven't made a little graphic for that, by the way. And are we already getting comments?
No.
Oh, and you can comment also over the, what do you call it?
Volume there.
Oh, I need to turn down the volume on this one. Okay.
Over the live chat.
So the reason,
Or
what?
Super chat.
Or super chat. Yes, thank you for pointing that out. The super chat is always welcome. So you can super chat
There we go.
to the fullest extent. We are welcome to production comments today because let's see, what time it was where I realized I didn't have one of the crucial audio components to our
4:10?
studio. 4:10.
20 minutes ago?
20 minutes ago, and had to. Am I offending somebody if I say jerry rig?
I don't know.
I think that offends everybody named Jerry.
You got to be so careful these days.
So we had to Gerald rig but we got the audio working so that
Hopefully.
you can call in. If you do call in, it's going to be interesting. I'll say that because I have to stand up and do something to make it. Yeah, I had a short. Oh, actually, I had a cable that's long enough. I just didn't have time to get it.
Oh.
Yeah, are you looking at my phone dangling from?
I am. I'm trying to figure out what's going on with our cords here. It's impressive.
Is that hot in here?
Oh, I'm pretty sure it's just you.
Is it me? So thank you for coming to Daily Aspirin.
Question mark? Huh?
That's the title.
That's the title.
Actually, I would guess that many. Yeah, the title was out there. The title was out there, not much ahead of this, but the title was out there 20 minutes ago.
20 minutes ago.
When
So
we
probably haven't had
decided.
time to check out my
For
blog
sure.
and read up and study.
Should I admit to?
He didn't. He had a busy day. You didn't even read the blog
I
today.
had to drive to a
So I
medical
will
school
educate
and
you
talk to people
on
and-
aspirin.
So I'm guessing it's not something new to me.
Well, people are already. It may not be the specifics of the study. Probably maybe. But
Yeah, I know that in general,
Yeah.
the conclusion as far as what we do is look
Right.
at the, we'll talk.
yeah, we'll talk about it.
We'll
Yeah.
talk about it.
Yeah,
What
so
it is we look. See,
people
now
say
you're
that.
intrigued. What is it they're looking at?
What are they looking at? So everybody's saying hi, Brio, James, Susan,
Hey, Brio.
Tracy, Bianca.
Bianca,
All of
Brio
them.
and Bianca, they're like, man,
They're on it.
you two
Every day.
are so,
And they're
yeah, you're like Power Rangers to me. I don't know what that
How?
means.
I thought you were going to explain, and I was sounding impressed until you just said you don't know what that means.
Red
All
Power Ranger, Aqua Power Ranger, Auburn Power Ranger. They're different colors, right?
I think so.
Oh, are they primary colors?
I'm pretty sure it's red, yellow, pink, black. There's a green in there. There was
Black.
a white that came on later, but this is like the old original
Okay.
Power Rangers.
I'm
from,
talking
like,
about the
when I
one
was
that
a kid.
Jonathan made me watch.
Yeah, that's a while ago. Anyways,
His brother.
there's like a 5th generation Power Ranger thing going on now. I don't know.
Okay.
My kids aren't into that.
Never watch it,
fortunately.
except for the Mighty Morphin Power Rangers, the live-action movie that Jonathan made me watch.
Yes.
Just wanted to throw that in one more time,
Thanks,
in case
Jonathan.
Jonathan's watching. So you guys probably have questions about daily aspirin, and Dr. Gawain has some things to say, and I can
have
talk about.
answers. Oh well, people already made some comments.
Okay.
Somebody said aspirin can cause a gastric bleed. And
What? What?
Yeah,
Aspirin causes
what?
gastric bleeds? What? Aspirin
Crazy.
can be dangerous?
There are side effects to this.
There's side effects to a medicine,
What? Take your daily aspirin, according to Bayer.
according to Bayer. Wink. Wink.
So, no, yeah,
Don't do it.
No, don't do that on here.
Don't do that. Okay.
So aspirin has some side effects. So we used to.
I did awesome on a test this morning.
So doctors used to say, take your aspirin every day.
I got an A, 2 B's, and a C.
I'm trying to keep us on task here.
Okay.
You just keep veering off.
Okay.
I'm trying.
Sorry.
All right. Anyway, so aspirin used to be thought of as a very safe medication. Just take your baby aspirin every day.
Just 81 milligrams.
81 milligrams.
It's
and
like
that
a
can help
quarter of an aspirin.
prevent your heart attack, your stroke, and that general cardiovascular.
Make you healthy,
events.
wealthy, and wise.
Oh, I never heard that one. There you go, Bayer. That is your next slogan.
Name it, pray it, claim it.
And that's what aspirin.
Thrive.
What? You are in rare form today.
I made me laugh. I had 2 caffeinated beverages today.
Oh, this makes sense now. So let me tell you a story about caffeine and Dr. Mark. So we went on a...
I'm sitting still.
You think you are. We went on a...
Everything's in slow motion.
I can't even get a thought out. Look at this.
Anyways,
a continuing education. It was actually for a computer system we were using. We went to a thing and we stayed in the same room. And one of the days, what was it? It was a red soda with a lot of caffeine in it. So I went to bed and I woke up at 3 because the light was on and somebody was completely inventing a new website and podcast because he couldn't sleep because of caffeine. So
I see it differently. I was inspired. And actually,
inspired by the red drink.
On my mobile phone.
Sugary red drink.
What year was it? It was like 2015, I think, wasn't it?
That's probably about right. No, maybe before that. 14?
No. But back then, I was so impressed I could do this. On my mobile phone, I had bought a domain name, made a website. This is all on the phone. And started a podcast. It was called eClinical Works Podcast.
Yeah.
It was about the electronic medical record we were using at the time called eClinical Works. And by the time he woke up, it was all ready to go. And so he was my co-host, and we did a few episodes before we changed our electronic medical record system to Epic. And there is no Epic podcast from us because
people
we
are
don't even know where
commenting.
to start.
James says you're so excitable today.
James,
you can't stop smiling. You can't stop it.
Yeah.
You can't help it. It's not you of heart attack or stroke in that group with a daily aspirin. There was, however, a 1% increase of GI bleed. The other group for diabetics did decrease their chances of heart attack or stroke by 1%. So 1 out of every 100 people treated were decreased. Again, another 1% increase in bleeding, abdominal bleeding. So that's one. Those are 2 studies looking at diabetics and non-diabetics.
We may have been on to check real quick. Boy, the volume is really out there. If that's the case, we need to summarize that study again.
Uh-oh. Did you hear the study? Are we back in? Are we back on?
Yeah, one thing indicates we're fine. Well, actually, it says we have 0 viewers there. So
This says 14.
that says 14?
Yeah.
Oh, there it says 14 again. Do they need us to summarize those 2 studies? Does anybody make a comment? Sorry about that interruption.
No, but basically, not helpful if you didn't have diabetes, taking a daily aspirin.
And didn't have heart disease.
And no heart disease, yes.
And you took a daily aspirin. The chance of you having something bad happen from
average risk, it was,
was equal to or greater than the chance of it helping you.
Greater than the chance.
Greater than. And so it'd be like a GI bleed.
Right.
That was the main thing.
That's the main thing in this study.
Was there also kidney injury? Was that?
They didn't, that wasn't an endpoint in this study.
Okay, all right. Sorry to interrupt. Go ahead, continue.
So another study published a little over a week ago was is it a cohort study where they look at other studies? No, but they looked at 13 other studies.
Like a meta-analysis?
There you go. That's the word I'm looking for. Meta-analysis, where they looked at 13 other studies that had been done on primary prevention using aspirin of heart attack and stroke. And that study found that they were looking for the increased incidence of bleeding in the brain or intracranial hemorrhage.
It happens often enough that it would show up.
And for daily aspirin, 2 out of every 1,000 patients will have an intracranial hemorrhage.
Over how much time?
I'd have to look it up, but it was significant enough. And that may not sound significant, like 1,000, but you extrapolate that out to the probably millions of people taking daily aspirin. That is significant.
That's a lot.
Yeah.
I didn't realize it'd be so high.
Yeah, it's pretty crazy. So that comes back to our original question: who should be taking daily aspirin?
I'm sorry, was that diabetics or general population?
That was everyone. All comers. All comers. So they didn't talk about whether it helped diabetics or not. They didn't talk about the help, and they were just looking at the adverse effect, of a intracranial bleed. So comes back. to who should be taking it. So if you're of average risk and have never had a heart attack or stroke and do not have diabetes, you probably should not be taking a daily aspirin.
GI bleed, and apparently intracranial
hemorrhage,
bleed.
bleeding in your brain. Mostly subdural hematoma, which is bleeding on the outside of the brain, technically. But
Which is usually triggered by trauma,
yeah,
a bump to the head, which
right. Which could
2
still
out of
happen,
1,000 people,
but-
you could imagine 2 out of 1,000 people would bump their head over.
And if you're on aspirin, you're
whatever
more
period of
likely
time.
to shear those veins and
Yeah.
bleed. So that is the basic takeaway. Most people should not be taking an aspirin, but who should be taking aspirin? So,
Okay.
one, if you've ever had a heart attack or stroke, you should be on some type of blood thinner. Usually aspirin, sometimes something stronger, depending on
There are some exceptions,
the circumstances. Yes.
okay,
Yeah.
but we won't go into those.
Yeah, yeah. That's kind of beyond what we're talking about. So those two are like the definite. Definitely should mostly. Definitely should not. There's this kind of in-between group.
Who's that?
So the in-between group would be those with a slightly increased risk of heart attack but have never had one. Not slightly, but an increased risk of heart attack but have never had one.
So is that where the little calculator comes in? That
Yeah. So
we're
let's
going
talk
to talk
that.
about something here.
Go for it.
Okay.
I've been talking a lot.
The American Heart Association and the American College of Cardiology came up with a type of calculator, and you can find it online. What you do is just search for AHA or ACC risk calculator, and you can find these things that'll be online calculators. You just punch in numbers. Here's the thing, though. Chances are very few of you watching this will be able to punch in those numbers because you have to have a current blood pressure and, oh, that's interesting. I have never seen it.
There's a blinking light.
Oh, I know what it is. Hold on a moment. Just, can I pull this with me?
What's going on?
I know what that is. I'll be right back.
Your Gerald rigging
Gerald, that's
not
right.
working. Hopefully,
No, I know what that is. I know exactly what this. So you guys are going to see a little bump. Hopefully not, but up there, I think I just bumped things.
oh,
Will this turn it off?
well,
There we
no,
go.
it's still on, and the light's off.
No, that's off.
Yes. Okay.
That's all I want to turn off. Okay, you guys can
Yeah,
still call
anyways.
in. I'm going to sit down.
You were talking about the ASCVD score.
ASCVD, arteriosclerotic
Cardiovascular disease?
Cerebrovascular, arteriosclerotic, cerebrovascular. Anyway,
Something like that.
heart disease and stroke risk is
Yeah.
what it comes down to. ASCVD.
Yes. So you were saying how you calculate this. You go to a website and start putting in some
Yeah,
numbers.
the
which
numbers
they
you need are your
may or may
systolic
not.
blood pressure. Some of them ask for your diastolic blood pressure, but actually, if some of the calculators don't have diastolic blood pressure, why do some of them require that?
I don't know.
Okay. And then the other one is your total cholesterol and your HDL cholesterol, because they're basing this calculator on studies that show those and the risk of heart attack compared to those numbers I'm just describing. But yet one of them requires your LDL. If you go online, you'll find. So
There's different, calculators.
why is that LDL? Is it actually used in the calculation?
LDL is a calculation in itself.
Excuse me. I don't know.
Anyway,
I'm coughing. Away from the mic. Good. Sorry.
away from me.
Away from the co-host.
So
Not that
you
I'm the
throw-
host.
you
We're
plug all-
co-hosts. It's not host and co-host. It's co-hosts. Just want to
Good.
clarify. So you use these numbers. Are there any other? Oh, your age, race
Gender.
is taken into account because, and I know that there's arguments about using race for calculating risk for things because it's not an absolute, and you can have people of different races that are actually from different parts of the world. You know, you say someone's black or African American, but yet, well, no, there's no African in them at all because they're Australian. So it's yeah. Forgive us, it's not exact. Age, race, sex, and then the other numbers we described. And it will come up with two numbers depending on your age. And it's really strict, the ages that this works for. Like it stops working at age 74 for your 10
Right.
for your 10-year risk.
Right. Mhm.
Is that right? Or for the
Yes.
lifetime. One of them. And it gives you the risk or the chance of you having a heart attack or stroke in the next 10 years or lifetime, depending on which one you're doing. If you're young enough, it'll give you both of them. And we look at that, and we want that to be, well, we want it to be as low as possible. But I think there's a cutoff at 7.5%, if I'm not mistaken.
Yes. Yeah, that's what they say the cutoff is.
And so if somebody's risk
For
of having a
high
heart
risk.
attack, what?
For high risk.
If somebody's risk for having a stroke or heart attack is 7.5% in the next 10 years, then we recommend they take an aspirin a day, baby aspirin a day.
Now, I've heard 10% by some.
Have you?
I think that the recommendation by the USPSTF, United States, Preventive Services Task Force, I think they say 10%. If the risk is over 10% on that,
Okay.
then you should. And they're a little vague in their recommendations too. They say age 50 to 59, there's B-type evidence. Age 60 to 69, it's not as good. And then beyond that, that's all they say. They don't say anything for anything over age 70 or below age 50. Or anything with diabetes or without
The
diabetes.
older, the more beneficial the aspirin, or the older the patient, the less beneficial?
Less beneficial.
Less benefit as you get older.
But insufficient, let's say that. Insufficient evidence to make a recommendation.
But less compared to the younger.
Yes,
population.
50 to 59 is that sweet spot that they say that you could probably get the most benefit from taking aspirin. Interesting.
So once you turn 60,
just stop it. Throw it out.
you can. You can. It's an option, I guess.
Yeah, I guess so.
According to what you're saying, the evidence shows.
Somebody was asking about references for these articles. Actually, if you go to the blog, there are hyperlinks there. You can just
Oh, you're good.
like that.
Oh,
you can click
that's
on
good.
them, and they are there. I don't
This
have
is
them.
quality medical education right here for,
But they are
for
there.
a general audience,
Yes,
non-medical audience.
yes, yeah. But you can definitely see all three of those articles. There are hyperlinks in the blog from today. So if you is there a link in the description below to the blog?
There is, I think, somebody tell us. I think there's a link to drgreenknight.com.
Yeah, just go there,
think.
and it's on. It
think.
just says, yeah. what's
Pretty
up with
sure.
aspirin. So
And then it's the first or the most recent article at
Right.
the time that this video was made.
right, yeah. If you just look up aspirin in the
Okay.
search bar. you'll
So
find it
no
there,
phone calls on the phone.
No.
But we do have comments coming in.
Yeah, a few comments.
We
Let's
do,
see,
we do have viewers.
few people.
That's pretty cool.
Let's kind of get updated here. Oh, that's where we left off. You were excitable.
I'm mellowed.
Caffeine sounds better than amphetamines. Right.
I picked the wrong day to stop amphetamines. Poor
Let's see. My husband is high blood pressure and on tablets. He used to take aspirin, but doctor took him off.
We're doing a lot of that these days. Good question to ask your doctor.
A lot of people. Yeah. Everybody's situation is unique, so definitely have a discussion with your doctor if you feel like you're not in those extreme categories where you should or shouldn't be
This
taking.
question actually came up today in an exam.
Yeah, it's pretty often these
I
days.
think I only saw
that
4
I'm getting.
patients this morning before I ran out.
Excellent.
And one of those 4 brought up this question. Don't ask why the schedule is so light this morning. That's a whole different story.
Oh, somebody says they're not getting. I am still updating my blog. I'm sorry, you're not getting.
They're not getting it?
They said they subscribed, but haven't heard anything. Well,
Oh, that's not good.
yeah, I'm gonna have to look into that. But yes, it's still every week, every Monday. I've been putting out a blog, so you can go check those out. You can even just go to the website; they are all there.
Okay.
Let's see. Bianca has an appointment with hepatology next month.
Oh, really?
I guess.
Well, I hope it goes well.
Yeah. Let's see. Somebody says they're not allowed to take aspirin because they have regular operations and bleed massively. Yes, that would be another reason. We hold
Regular
it typically.
operations.
I don't know what that means by
think
regular.
I think we need to explore that.
Yeah. We do tell people to stop aspirin before we do procedures on them.
We haven't stopped it. Well, I
Night
do for
before.
3 days myself.
I do it at least the night before. Sometimes I do 3.
Yeah. Yeah,
So.
just to. And here's the reason that we stop aspirin for days. It's because its action lasts for days. It acts on platelets, and its action is irreversible to platelets.
Yep.
Which sounds really scary because your platelets are messed up for the rest of their lives. It's okay. Platelet lives are only a week or 2 long. They don't get very old. So
Yeah.
it's like a couple weeks before you're totally back to normal after you stop aspirin.
Yeah.
Did I do
That's
okay
how
with
it
that?
works.
Did
Yeah.
I do okay with that?
Very good.
All right.
You're okay.
Thank you. I need that assurance. Pat me on the head. Yeah.
Yeah. James, you got the links. Perfect. Good.
Okay.
Yeah. So,
I think we covered.
oh, somebody says they're on Warfarin.
Oh, that's a whole different world.
Yeah, and so they say
Yeah.
no daily aspirin. You're right. We there are some rare cases where we'll combine the two, but it is extremely rare. That increases your risk
I don't.
dramatically. Yeah, that's usually done by a
cardiologist
cardiologist.
puts those two
not by
together.
a primary care provider.
For those who don't know, Warfarin, instead of being like aspirin that keeps platelets from doing their job making clots, it stops something else in
Yeah.
the clotting
Clotting
mechanism.
factors.
And it really stops the body from clotting and really puts you at risk for bleeding.
Yes.
And really has to be monitored because its
Very close.
activity goes too high or too low, almost with just looking at the person funny. It's very sensitive
Lots
to
of
vitamin
interactions.
K in foods. It's very sensitive to other medicines.
Antibiotics
And-
especially.
Antibiotics, and if a person thinks they're stable on it and stops checking their blood regularly for how the level is, it'll change. Even if they're eating exactly the same thing, taking the same
It's-
medicines, it can still change. So it's being replaced by some newer anticoagulants, but here's the thing. They are so high priced, it is just not realistic for many people to get it. I mean, are you going to pay hundreds of dollars per month for one of your medicines? Some people, that's what it would take to use something instead of Warfarin for their anticoagulant. And this gets into the whole political thing about the drug
Medications,
companies in the
everything.
pockets of Congress. And don't get me started.
Maybe I should write a blog on that. That would get way too political
Yeah.
very quickly.
Yeah.
Anyway,
Okay.
anything else you need to talk about? Where were you
Promote-
for lunch?
Oh, I had lunch with a doctor at California North State University College of Medicine,
Hey,
where we are hoping to get some students. We'd love to have some students from California North State University join us here at the Auburn Medical Group to learn about independent medical practice, specifically primary care,
Yeah.
that takes advantage of the way Medicare is kind of restructured, how it pays doctors, to allow us to spend much more time with patients
Right.
than those people who think we have the luxury to. The reason we have the luxury
It is
to
a
spend the
luxury
time
that
with patients
we,
is not because we have spouses who support us. That is not the reason. It is because we have fully committed to.
it's because I won the lottery.
It's because we have won the lottery. Because we fully committed
Because
to.
I came into a large inheritance.
when-
Wait, my parents are still alive. Sorry, Mom and Dad. No, it's not for any of those reasons.
we fully jumped in with both feet to annual wellness visits, to chronic care management, remote patient monitoring. All these things are things that Medicare has set up to encourage value rather than volume style of medicine, where we spend time with patients, we check on them on the phone often, not necessarily in the office as often, but it can be, depending on what's wrong with them, whatever's appropriate for the medical condition. Because Medicare has found that if we make this shift toward really emphasizing preventive care and making it a priority and not letting it slide when the patient comes in for something else, but still making sure it gets done, even if it's over the phone after the visit, patients do better. Less hospitalizations, less complications, cost Medicare less money. And so they've, instead of paying doctors more according to inflation, which they stopped doing pretty much,
Yep.
they have these other ways of paying for care that incentivize good care by making sure blood pressure is controlled, making sure diabetes is controlled, making sure colorectal cancer has been screened for, and some other measures that they use that are surrogates of good health care. So we are big-time believers, and our patients are doing better with the shift. Our patient satisfaction scores are doing better, showing that the patients are more satisfied. We think they're doing better because of them having less hospitalizations and having less exacerbations of their illnesses. So we want to have students learn that style of medicine and come to us. So
Yeah.
California North State University College of Medicine students are invited to join us in their third or fourth year to rotate and learn that style of medicine.
Yes. We enjoy teaching.
And we like teaching.
And somebody's asking if we do small operations in our office. Yes, we teach those too. Like
Shave biopsies,
sutures,
punch biopsies, some excisional biopsies,
Excisions.
some cyst removals,
cysts,
cryotherapy,
incision and drainage of like
Yep.
abscesses,
and
injections.
what urologic procedures are you doing?
What urologic procedures?
Circumcision.
Prostate checks.
Circumcision?
Circumcision. Yes.
Not on adults, though.
No, babies.
And are you doing vasectomies?
I haven't done any. No, not here. I've trained in vasectomies, but have not done any.
Okay.
Since I moved here.
And there's this thing in medicine where if you're not doing a procedure regularly,
Yeah, you shouldn't.
yeah,
Yeah.
Bummer.
Back into it. Yeah.
Okay.
Oh well.
You want to do mine again?
Your vasectomy again? I think,
Do another one?
I think I'm good.
Okay. Just ask me. You need practice. You can do that in Dr. Schroeder's class, or Mr. Schroeder's class.
Practice. Oh my gosh.
Well, if you put a drape over the field. No? Not so much?
Oh my goodness. I think we're, yeah. anyways.
Sigmoidoscopy?
Oh, that we should do one of those. That's coming up.
Well, somebody's coming up on their 50th birthday, and
Hey.
I don't know if we could get a GI doctor to bring in a whole colonoscope into Mr. Schroeder's classroom. I'd do it, but I just don't know if it's practical. So
Yeah.
write in with
Anyways.
or in the comments, right? What you think of that idea.
Oh, we
And
know
of
what-
course
we know
it'd be
what the
live on
answers are
YouTube.
gonna be. Yeah,
We
live
wouldn't-
on YouTube.
We
a
wouldn't be able to have
colonoscopy.
any advertisements on it. It'd be considered advertiser unfriendly, like all of our other procedure videos.
When you start to
When you start to undress.
insert things in places.
We did have some nudity on Friday's video. Did you see it?
Yeah, you were bare chested on that video. I
That's
think.
right. Yeah, with the EKG.
Ladies, check it out.
Can't believe you said that. Well, there actually was. There actually was in the comments when we said there was going to be
Oh,
some
my
frontal
goodness.
nudity. There was a comment. Do you know
Oh,
who it
no.
was from? It was from Lindsay Vaughan,
Oh no.
complaining that we did not represent it truthfully, that video, because we didn't do it. But then we did do it on Friday's video. We actually did show the EKG.
Oh,
so
man.
there you go, Lindsay.
Got to be on bearskin for torque. Anyways,
Yep.
do you have anybody you'd like to thank for making this
I do.
possible?
Lindsay Vaughan.
Hey, who were we talking about?
Yeah, how about you?
Thanks. Yeah, BooBoo Kitty.
BooBoo
Thanks for
Kitty.
supporting
There we
the
go.
blog. Appreciate it.
Some people may wonder why we say those names every time and how they can be a part of that, how they can get their name on.
Yeah. Well, you can.
Is there a way?
I think there is. If you go to Patreon,
Okay.
those are the people who are at the higher tier of sponsoring the,
The highest, I
videos
believe,
and
yeah.
the highest. Of
So your
sponsoring the blog.
Patreon is patreon.com/.
Dr. Green Knight, Dr. Green KNIGHT.
There's probably a link at drgreenknight.com, I would
Probably find it
guess.
there. Yep.
And mine, I don't know, there is a link anywhere. There used to be anyway. And mine would be
I think it's Dr. Mark.
patreon.com/Dr. Vaughan.
Yeah.
But
Yeah, that's what it is.
hey, if you want to get your name, you can. We'll gladly put your name out if you do that. It's if you want to.
Yep. we
I don't want
appreciate
you to feel a high pressure sale. This is not public television.
it. Oh, we should do it.
We're not going to turn off if you don't support us. We'll still be here because we're annoying you. That's
Yeah. Because we have fun, and even if nobody was watching us, we'd probably.
If the numbers were zero, we'd be sitting here in a room staring at nothing,
So
as if there's people watching. That's what we would do.
As we
So
watch it,
I'm
we
sorry, this is
still
getting drawn out, but
Anyways, we should probably get.
you're so kind to come here every week. Thank you, and a special thanks to. We're getting a call. Okay, we got to take a call.
Oh,
This is going to be awkward.
who's calling us?
I don't know, but they're going to be live, whoever it is.
Oh, I should put in my.
Okay, this is Dr. Vaughan, and you are live on our YouTube channel called Auburn Medical Group. And
Hello, Dr. Vaughan.
yes,
Uh,
you are on the air
Try to see if I can.
in front of our live viewers. What's your question or comment?
Oh, you know what? I will be calling you back later. This is a personal matter for one of your patients, so I'm apologizing for interrupting.
Well, you are welcome to have a medical question for the show.
Oh, this is a specific return call back from Diabetes Patient Education, so we'll call you at another time.
Sorry. Well, again, apart from the official capacity, if you have a personal medical question that you would like answered on the Auburn Medical Group live show in front of our live audience, you can ask it, and they can hear you, by the way.
Well, wonderful. Thank you so much for the opportunity, but
She's
I'm going to
passing
let
it
you
up.
go.
She's passing up
Thank
this
you.
opportunity.
Oh.
Can you believe it?
I don't even know who it is. I can't hear.
Oh, okay. Well,
Anyways.
yeah, I'll take your call after you call back.
Thank you. Bye-bye.
But thanks for calling in. Okay. Did you guys hear that? You could. I'm sorry. It's because of the way I Gerald read it.
Yeah.
Okay. Thank
Put it
you.
on and everything.
Until next time.
Dr. Quinn.
And Dr. Mark Vaughan telling you to stay in good health.